Welcome back. We're at the Bebout Veterinary Medical Center, and I'm with Dr. Brandon Bebout. We have a very special guest for a very special reason. Good morning.
How's it going?
It's going great. How's Kiara?
Kiara's doing well, and the reason she's doing well is because of our topic today.
Okay, what is our topic today?
It is on a, I'm going to use the word, it's a strong word, revolutionary, but I really think it is. We had already done a talk on Solensia, remember?
Yep.
For cats. Only thing we have for osteoarthritis in cats, and so that's going to decrease the pain and inflammation in those guys. We've seen wondrous things from that, and so Librela, Librela, Librela is the analog in our canine patients.
Okay. And you kind of have a drawing back here to kind of break it down for us.
Yeah, I just, you know, we talked about Solensia. It acts the exact same way as Solensia. I use my hands a lot. I've been told that anyway. And so we did kind of draw this up here just to kind of give the people an idea of the science behind this and why we call it revolutionary. And so we have our neuron here with nerve growth factors, one of these little Y molecules, and so those are binding to those neurons in times of arthritis, pain, inflammation, and that's what's causing it. And so what Librela does, what Solensia does, is they go ahead and they bind that nerve growth factor, and if we bind the nerve growth factor so it can't attach to that receptor, then we're going to see a decrease in nerve growth factor, which therefore decreases pain and inflammation.
Now, is that arthritis the main usage for this, or is there any other use?
It is. So we've had it in the hospital 14 days. So very, very recently FDA approved in the United States. It's been in Canada, New Zealand, Australia, UK for 5 years maybe, and just more red tape here in the United States. And so now we've got it on the market. It is labeled for osteoarthritis. Now, it's a very good question because in cats, we see stomatitis. Anything with itis, arthritis, stomatitis, gastritis, inflammation of. And so we know that nerve growth factor is increased during times of inflammation. And so we have used it in cats with really bad mouths and have seen some success. We always wonder about cystitis, inflammation of the bladder in cats that we've used it for and have seen some success. And so I think that there are probably some off-label but relatively safe, which is probably your next question, sorry.
Yep.
And so we think that there's going to be some other uses, but obviously in our canines, they're living longer and longer. Kiara here is 12. She's got elbow dysplasia. She's had pain and inflammation from, since she was 5, and this has been kind of a godsend for her.
Is it a topical or is it a pill form or?
It is actually an injection. It's exactly just like you get your rabies vaccine. It's 1 mil of this, and it's by weight. And so it's just a different milligram by weight. And so there's a little chart, and 22 to 44 pounds, you get a 10 milligram, and then you're on your way. It's going to take a few days to see that effect. It's kind of an analog to our Cytopoint that we've talked about. Anti-allergy binds the reason for the itch. Same thing here, just with the nerve growth factor. And so that's going to take a few days for that to really get that nerve growth factor down for us to see the results. And then we're thinking, they label it every 30 days. I tell people do it 30 days apart and then kind of on an as necessary basis. But it's one of those things where that will allow us to reduce the necessity of some of those other medications that we like and we can still use, but if we're going to use them in a decreased frequency, we know that that's better for all the side effects that can occur with those.
Wow, so that is revolutionary. It truly is.
It is.
Yeah, so come on in, make an appointment to make sure that your pet can, live as long and happy and a healthy life as possible.
Yeah, we've got Kiara doing zoomies around the house all of a sudden. We've lived in the house for a year. We just thought, it's kind of weird that she's excited to see us for the first time, but 3 days ago she got Librela, and we've seen it in her, we've seen it in other patients, 3-legged dogs, when they got that lone front leg from a amputation, and it's just really exciting to see, and so we're excited to use it. So get on in here.
Well, we're excited for Kiara. Thank you, Doc. Appreciate it.
Of course.
All right, stay with us for next Monday's edition of Pet Doc.